Fibroids are the most common type of benign uterine tumor, affecting more than 30% of women in this country. In our continuing series on health information for women, Lorene Cachola takes a look at a new minimally invasive procedure that helps shrink fibroids without surgery.
Cramping, abdominal pain, leg pain, excessive uterine bleeding, all signs that you could be suffering from fibroids. Unfortunately, many women don't recognize the warning signs.
A lot of women don't know that they have them. They do kind of run in families, and so women will have heavy periods, and their mother will have had it, and their sister's had it, and they just think that that's sort of the way they should be.
If you experience any of those symptoms, your gynecologist can perform an ultrasound to check for fibroids. Standard treatment for uterine fibroids is a hysterectomy, but many surgeons are offering patients a less invasive option, uterine fibroid embolization.
It is safer overall in that it's a minimally invasive procedure and no large incisions are made. I think it's just grown in its use due to more information about it, and longer-term studies have come out validating how good the procedure is.
It's a relatively simple procedure for both surgeon and patient.
They usually come in early in the morning, and we put them on the table and get them sleepy but not completely asleep, not general anesthesia, and then just make a little incision in their groin about the size of a pencil head and put the catheter in, direct it into both uterine arteries, and inject some little plastic particles that block off the blood supply to the fibroids, and that causes the fibroids to die off over time. Get the catheter out, then we usually keep them overnight.
Recovery time for embolization is approximately 10 days versus 4 to 6 weeks for a hysterectomy. And while the effects of embolization on fertility are not known at this point, Dr. Zini reports patients having full-term, normal, healthy pregnancies following the procedure. Another plus in the advancement of women's health care. For Smart Medicine, I'm Lorene Cachola.